All right, hi guys. Okay. Can you hear me?
Yes.
Good, good. Hi everyone. It's nice to see that people have started joining. Do share and invite other people. It's LAJ Academy, as you're aware, IMG, Development and Competency Training. And today we have a beautiful presentation by Bartholomew. He's going to be doing his presentation on how to teach in the NHS, the applicable basis of medical education. But before then, I would just give us a little bit of run through. And why this is important is if you have a look, the UK Foundation program, there's a lot of importance to this there in the area of supervised learning environment. Hi, those and then Goodness, nice to meet you. And you guys can put your question in the chat below. And don't forget there's certificates, so please do stay to the end of the sessions. So before we, Bartholomew, if you try sharing your slides, let's see.
Oh gosh.
Otherwise, maybe send them to me and I can share them on your behalf.
Okay. I'll try to do that. Okay. Please bear with me.
Okay, so in the meantime, before Bartholomew settles down, I'll just talk about a few key aspects of medical education applicable to the NHS. So as many of you would be aware, with the foundation program, there's something called the supervised learning environment. And one of the key aspects of that is the case-based discussion, and also areas like developing the clinical teacher, direct observation of procedural skills, and mini clinical evaluation exercise, which is called the mini CES. And then there's the leader part. All these aspects of teaching in the NHS that you should be aware of, because if you get into the NHS as part of your role, you'll be supporting essentially the FY1s and then the medical students in these areas. I'll talk about them in details a bit later on, but this is some aspect of a medical education applicable to the NHS that is very important. Okay, if you are not able to send, just share, just email it to me and we can get you up and running. So why Bartholomew is here is also useful to just explain, medical education as it is. So one of the books I strongly encourage people to get is a book called Understanding Medical Education. Very, very useful book. And I'm going to just talk a bit about it because it's a really good primer to those new to medical education.
Okay.
Yes, so like I was saying, the book Understanding Medical Education is very So Understanding Medical Education, Theory and Practice is a very important book that everyone, meaning to do well in this, understand medical education um, needs to find time to get used to. So there it addresses many aspects of medical education.
Oh gosh.
Now, I mean, if you can just send it to me. Hello?
I'm trying to see where I saved it. Okay. Okay, I've gotten it now. I'll send it across now. Sorry, copy, paste, new, sorry, new folder, paste.
Okay.
Oh gosh.
There. So Understanding Medical Education is a very important book that is really very good reference guide. And in this book, there are basically three aspects to medical education. So undergraduate medical education is essentially that aspect of medical education that has to do with the teaching and education of medical students. Now, when you look at that aspect, so the various curriculum around teaching and education of medical students, it's a big aspect of that. Then the other one that you move to is postgraduate medical education. Here, the emphasis is the teaching and education of people that specialize after medical training, and that would go across specialty. And sometimes you have a bit of specific language for that. And then you can hear things like surgical education, which tends to be the education of, surgeons, gynae surgeons, general surgeons, neurosurgeons, and the like, general practice education or medical education in general practice and the likes. You may also come across the term clinical education, which tends to be more all-encompassing. One of the things to note, the difference between clinical and medical education is clinical education tends to be medical education that takes place in a clinical environment. So that would be more around hospital type education. Then you hear of health professions education. This is a more broader term. So it would cover everyone beyond doctors. So it's interchangeable now. It's not something that would be done in isolation, but a good primer to start. This is the book that gives you a really thorough overview of the field. So with that said, we will go into more for today's lecture. So before we get Bartholomew back, does anyone have questions? Now, the part of medical education is the continuous professional development. That's the CPD part, and that's the part that generally you need to revalidate and keep your license, going and alive. So I'm going to now share his presentation. Have you gotten the new one, the latest one?
No, you can share. You can share the former one.
Good.
Are you sharing it?
I'll let you know once I've shared it. Okay. Stage is yours. Hello?
Thank you very much. Good evening, everyone. Thank you, Dr. Jonathan, for giving me this platform, for taking this topic on how to teach effectively in the NHS. My name is Dr. Bartholomew. I had my primary medical education in Nigeria at the University of Nigeria, Enugu campus. I trained at the University of Nigeria Teaching Hospital. And I graduated in the year 2009. I've been in medical practice for over 10 years before relocating to the United Kingdom. I passed my PLAB 2 last year, and I'm hoping to join the NHS as soon as possible. Dr. Jonathan's platform has been an opportunity for me to grow my portfolio, and I very much appreciate him for that. Let's dive into what we have for today, and that is how to teach effectively in the NHS. Teaching is very important to the NHS, and that is why this topic is apt for every one of us who intend to join the NHS. And I'll be doing this using this outline. I'll be taking us through an introduction down to principles, to talk about the learning environment, the practical teaching frameworks, then before we come down to the conclusion. Now, let's jump into it. It is quite obvious that the role of junior doctors in medical education right here in the United Kingdom cannot be overemphasized. And I'll tell you why this is so. This is because the junior doctors, as they interface with medical students, physician associates, even their nursing colleagues, as well as their colleagues as well, they pass on information. And this information, they are critical for patient safety and critical for the overall team performance. It goes without saying that teaching is a core skill that grows with practice. And that is why this forum or fora is very important, because as we have the opportunity, the platform to hone our clinical skills, definitely our teaching skills will definitely improve. Why teaching matters in the NHS? At the heart of NHS is the patient. The patient is in the center, and patient safety is something that is key. Dr. Jonathan, who has had a vast experience in the NHS, would agree with me that here in the NHS, patient safety is something that is very cardinal. Therefore, the role of doctors as educators are paramount. In fact, the GMT has expectations from us as medical doctors to be teachers. We all will recall that in our examination, one of the questions that come out to us in the plateau examination, which is now UK-IMG, is the teaching session. In those sessions, we are given questions which test our teaching skills. They tend to calibrate our capacity to teach our patients, our capacity to teach medical students, our capacity to teach our nursing colleagues as well. This is because the impact on patient care and team performance is absolutely clear to everyone. Let's talk about common teaching scenarios for NHS doctors. For NHS doctors, opportunities to teach abound. Speaking of that, we'll talk about teaching on ward rounds. Many of us, we are very familiar about our ward round environment, where we have opportunities to teach people. You could say on the ward round, you could have a patient who may have had an elevated body temperature. That could be an opportunity for us to look at possible causes of fever in such a patient. Also supporting our FY1s. You know, the FY1s back home are the people we call our house officers. You know, as junior doctors, we have this opportunity of impacting knowledge onto them. Another teaching opportunity for junior doctors is in teaching practical skills. Many of us can relate to our days during our house job, where we had the opportunity of being taught. And when we got to the level of registrars, senior registrars, or consultants, we had the privilege of passing on this knowledge to our colleagues as well. Now, speaking of these teaching sessions, at times when we have critical emergencies, we address those emergencies first, and that makes us to run short of teaching opportunities. Now, it goes without saying that the NHS is a very busy place. Now, how do you teach when you are in such a busy setting? So we are going to see different scenarios which call for us to teach our colleagues, which include the physician assistants, the nurses, the the FY1s as well. Now we'll have micro teaching opportunities. Now let's look at a scenario where we had a patient that decided to be newsing, had a high news score, the national early warning score. Now, if we have such a situation, maybe that patient's news score, let's say, was up to 7 or 8, it might be an opportunity for us to teach our colleague on the importance of escalating. Now, another opportunity is teaching during ward rounds. We all are used to this scenario back home. You know, back in the days, we used to have junior doctors, registrars, and we always want to be part of their ward rounds because we say that, oh, that registrar moves stuff. That registrar is stuffy. We also want to be in their ward rounds because of the astute teaching skills of such registrars. Now, we also have another teaching opportunity is that of using real case scenarios for learning. Now, we have instances where we may use real case scenarios. Let's say, for example, during our back home, those days, when we are doing our morbidity and mortality meetings, we look at those real cases and we use those opportunities to learn. Teaching is very important. However, we must balance teaching with the pressures, because there are a lot of work pressures in the NHS. Now, this teaching must be carried out in an environment. Now, if we have a teaching session to deliver, we talk about the physical environment and the psychological environment. Of course, for the physical environment, we want to find out the number of people we want to teach. How many people are we going to teach in this place? Then we look at, is the space adequate to take the number of people whom we are going to take? If the space is not adequate, it is up to us to make necessary arrangements of having an alternative avenue, an alternative venue for which we can have the class conducted. Then we also look at the environment. The materials for teaching, are they available? Do they have a speaker? Is the place conducive? Is it conducive for everyone? We look at the physical environment. And if certain things needs moving, we should feel free to move those things. Now, let's also talk about the psychological environment. Now, when we want to teach, the first 5 minutes is our golden time. It's a time to establish rapport with those whom we are going to teach. It's a time in which we want to build that chemistry with those people whom we want to teach. It's at that time we want to introduce ourselves, try to make the people whom we are going to teach, make them buy into what we want to pass on to them. Then, speaking of this psychological environment, we should establish some ground rules. At that point, it's a time to tell people that, oh, these are the housekeeping rules. You tell them beforehand. Perhaps the issue of phone, we tell them that, okay, in this place, if you are going to use phone in an emergency, it's okay, you stepped out and you make use of your phone. Of course, in communicating to the people we teach, the language we use in communicating to them has to be appropriate. A little bit more about the effective learning environment. We should encourage questions and curiosity. It should be an environment where we encourage them to feel free to ask their questions. In addition to that, we should avoid humiliation. We should let them know that no question is stupid. They are free to ask their questions. And moreover, we should model professionalism in our communications to them. We should show that we are professional, especially in the choice of our language and our communication. Now, you see, who are we teaching? As junior doctors, we are teaching adults. Somebody who is an FY1, a nursing colleague, a physician assistant. These are adults. Now, I want to share with us certain principles that underpin adult learning. It must be a learner-centered approach. Now, by this, I mean that the material we're going to pass on to them, we should look at it from the perspective of what do these people need to function effectively. It should not just be about, I just want to go and dump information on them. Now, to drive this home, now let's take, for example, we want to teach someone cannulation. We should be able to get to the mind of the person. What instruction does this learner need to get the process of cannulation very well? So our teaching has to be learner-driven. Another important principle to talk about is that our teaching should be self-directed learning and autonomy. You know, back in the days, we used to have the feeling that the doctor is the king. It is whatever thing we feel it's appropriate, it's necessary that we end up handing over to the patient. But in this environment, it is patient-driven, it is customer-driven, whatever thing we are doing. So applying it to what we are discussing today, our teaching has to be self-directed learning and autonomy. By this, I mean that whatever thing we are going to teach them, it should be learner-driven. That is, they should be the one driving it. Now, let me give you some scenarios. Now, you may have a scenario where somebody might want to come and you want to volunteer to learn about, you might come and say you want to learn about this procedure. You find out what exactly do you want to know about this. Now, I'll give you a clear example. Now, during those days when we are writing PLAB 2, in one of the teaching scenarios, one of the questions we ask them, what do you know about this thing? What exactly do you want to know? What principle are we what principle are we demonstrating? Learner driven. We ask them, what exactly do you want to know? So that is the same principle we carry on when we go to the NHS. Same thing with autonomy. They should have the right to choose what they want to learn. Then another approach is it should be problem-centered rather than theory-centered. That is talking about scenario-based approach. And these tend to stick more than quoting theories to people. Then another thing to talk about is motivation and barriers to learning. We should try to find out certain things that motivate learning. For example, the quest for career advancement. And I'm sure that is what has motivated many of us to come here today, because we want to earn things that will help us to advance our career. Now, speaking about barriers to learning, certain things could be barriers to learning for people. Now, in the NHS, the pressure is so high. People are so time choked. That could be a barrier to learning. Now, to the meat of our discussion, let's talk about the practical teaching framework for doctors. Now, it's not about having this stuff. It's not about having this knowledge. How do we deliver the knowledge? What is the method of delivery with which we communicate this knowledge to them? And that is what we want to talk about in the next couple of minutes. Now, there are a lot of methods or approaches with which we can deliver knowledge to people. Now, we have the Patton's four-step method. We have the Pendleton's feedback rules. We have case-based discussion. We have 1 minute preceptor. There are a couple of ways in which we could deliver lectures to people, deliver teachings to people. Now, I will start with the Patton's four-step method. Now, this Patton's four-step method is mainly used when you are teaching clinical skills, procedures. Now, let's say, for example, you want to teach someone how intravenous cannulation. Now, using the Patton's four-step method. Now, the first thing you do is demonstration. You run through the whole procedure. You show the skill. You demonstrate how to cannulate. After demonstration, the next thing you go to is deconstruction. Now, what do I mean by deconstruction? By deconstruction, I mean you talk the trainee through it. You say to the trainee, look, these are the different stages. You talk the trainee through the different stages. That is, you break them down into stages. Then the next stage is comprehension. By comprehension, it will be the trainee's turn to talk you through the process. So in comprehension, you want to test the comprehension, the understanding of the trainee. So the trainee has to pass back the information to you. And lastly, the performance. The trainee performs the task. Just to recap, the first stage is demonstration, second stage, deconstruction, third stage, comprehension, and the fourth stage, performance. Like as I said earlier on, this is mainly used in teaching clinical skills or procedures. Now let's talk about feedback using the Pendleton's rules. Many of us, when we did our PLAB 2, we often have the FY2s giving us feedback. And this is a procedure that is commonly practiced. What is done? Imagine those days, after you finish making your presentation, someone comes in. First thing to do is to clarify. You clarify any of the information or fact. Let's say, for example, somebody says something that seems odd. You want to gain clarity. Did you mean this? Did you mean that? So the first thing is what? You clarify. Still on this Pendleton's rule, you ask the learner what he or she did well. From the presentation, what did you think went well? The third step is what? You discuss what went well. You expatiate on, oh, your history was good. Oh, your examination was good. You harp on the things that went well. Having done that, you now ask the learner to say what went less well. You ask the learner, can you tell me what in your opinion didn't go very well in this presentation? Then next, you now discuss what went less well. So you discuss it with the learner. And finally, you agree an action plan. So to summarize, the Pendleton's rule, you clarify, you ask the learner what went well, you discuss what went well, you ask the learner what did not go well, you discuss what did not go well, and finally, you agree an action plan. That's the Pendleton's rule. Now let's look at this other rule, which is the case-based discussion. In other words, this is based on this scenario approach. So this is the scenario approach. You bring different cases and you discuss what will you do in this scenario. So you discuss that. Then another approach, another teaching method I want to talk about is the 1 minute preceptor. The 1 minute preceptor. Now, this approach is commonly used during word rounds. Now, imagine a word round that is ongoing. Now, what do? Let's say as a junior doctor, you saw a case. You could say to the learner, what do you think about this case? So the learner offers the learner gives a commitment, gives an opinion on he gives an opinion on what he thinks about the case. Then you now ask the learner, can you give me supporting information? Why did you make this decision? He provides the supporting information. After the learner provides the supporting information, now let's say, for example, now you are discussing the causes of anemia, and the learner said that, oh, I think this patient has a microcytic anemia. You now ask him, why do you think it is a microcytic, maybe hypochromic anemia? After after giving the supporting information, you now teach the general rules. Or you could say that looking at the slides, anytime you see the shape of the cell this way, it points to this and this differential. So you teach the general rules. And after teaching the general rules, then another thing you will do is you have to reinforce what went well. Okay, you reinforce what went well, and you now make corrections. So just to summarize on the 1 minute preceptor approach, first thing you do is what? You get a commitment. What do you think this case is? You get supporting information. Why do you think in this direction? Then you, after doing that, you now teach the general rule. Then after teaching the general rule, you now reinforce what was done well. Then you now correct if there's any correction or if there's anything that was missed. You now make the correction. With this being said, we've discussed the major teaching methods. So these are essential takeaways that going forward, when we teach, we remember the 1 minute preceptor, the Paton's 4-step method, the Pendleton's feedback rules, the case-based discussion. With this being said, now that we've seen that teaching is very essential in the NHS, are there some challenges that you want to teach, really? Are there some challenges on the way? And are there some solutions to these challenges? Now, one of the challenges is time pressures. A lot of those people working in the NHS, interestingly, my wife is a nurse, so I know the pressure they go through. And I've had the opportunity of doing clinical attachment. I've seen the pressure myself. There's a lot of pressure. You have, as a junior doctor, you have this task to fulfill, that task to fulfill, and another person is coming to you, asking you to do this or to do that. So it's a lot of pressure. Then another thing is a variable learner engagement. Of course, different learners. There are some that, speaking of variable learner engagement, you may not have adequate time to take them all through it. Then another thing is your confidence as a teacher. Of course, this teaching comes with practice, and that's something to keep in mind. Whatever thing you do first for the first time, you may not do it very well, but don't give up. The confidence comes with practice. So your confidence as a teacher definitely comes with practice. Then another challenge is managing differing levels of knowledge. Of course, the way you're going to teach people, that some people that they are very knowledgeable, you're not going to make so much effort. Then you're going to teach some other categories of people that probably their knowledge level is not up to the level you may expect. So you just have to know how to manage such situation. Now, here is a positive which we need to take away, that teaching gives us opportunity to develop. So when we go into teaching, it helps us in the long run. We have professional development as a clinical teacher. I'm sure our mentor, Dr. Jonathan, we have a lot to say on that. Then we have opportunity to have teaching courses and certificates. And that's the beautiful thing in NHS. By the time you finish your courses, there is what they call the ESR. There are a lot of learning platforms in the NHS. So once you apply yourself to these platforms, you have the opportunity of getting certificated. Then another thing is reflective practice. Now, let me harp on this a little. Now, after teaching something, we should go back. This thing I've taught, what went well? We should go back and still use that Pendleton's approach. What went well with what I taught? What did not go well? What can I improve So we should reflect on whatever thing we've taught so that the next time we have opportunity to teach, it will be an improved version of what we have taught. This cannot be overemphasized. Of course, it serves as a portfolio evidence for our growth. Now, why are we having this teaching? It is because we want to have a portfolio evidence, and that is what one of the benefits we enjoy when we teach. And finally, for mentoring and peer observation, and that is what this platform is all about, for mentoring and for peer observation. And that is why we give all kudos to Dr. Jonathan for the fantastic job he's doing in organizing this platform, so that at the end of the day, we'll get well mentored. And with this peer observation going on, we'll be all better for it. And to draw this to a conclusion, so far, I've discussed with us that teaching is a core clinical skill, that teaching is well appreciated in the NHS. And it's a skill which we must develop. And thankfully, we have this platform. And today is the inaugural session. And hopefully in the future, we'll continue with this energy and take it to a higher level. Of course, within this teaching session, I've shared with us the different teaching methods. I've spoken with us about the Patton's approach, the Pelditon's rule. I've talked to us about the case-based approach. I've shared with us the benefits of teaching and, of course, the challenges. And these benefits are for us as learners, for patients, and for doctors. And I want to leave this with us, that as we commit to teaching, the room for continuous improvement will grow larger and larger. Thank you very much.
Oh, great, very great session. Thank you, Dr. Bat. Guys, don't forget, I'm just putting the feedback form. Please fill in the feedback so we can continue to improve the session. And also, the feedback form is a requirement so that we can send your oh, okay. No. Yes, so that we can send your certificate. So the feedback, the form is the one. I don't know why StreamYard is creating. Let me take that one out. Okay, so amazing. So this is, of course, the first inaugural sessions. It tries to lay the foundation on, the basics of medical education, so people are aware, and so that you have an idea of, planning towards teaching, developing your own teaching practice in the context of the NHS. Also, it also tries to give the resources, that are out there. As the first session, there will be some, as you may know, something we call teething problems. So we're still getting that put together. So I'm just going to keep putting we need you to fill the feedback form while we're taking the questions. So quick question, someone said, so Bartholomew, they are asking for I think I'll leave you to respond. So Dosi has asked that, do we get to have the slides or better to make notes? So that's for you. Can you hear me?
Yeah.
Yeah, so the question that the people are asking is, do they get to have the slides, or it's your teaching session? What do you have to say?
Well, thank you for taking the time to listen to our presentation. Today is our inaugural session, and Well, as per your demand, that shouldn't be a problem. But I will have to discuss. I will have to know what the policy is. And thankfully, we have Dr. Jonathan. We want to know what the policy is.
I'm happy for you to share the notes, but I think it needs to go through some peer review just to make it a bit more all the encompassing. So I think typically what we would do is Dr. Bartholomew will go. No, it's the same link. Bartholomew will go through the video, update, improve the slide, and once we've paired reviewed it, we can give you access to it. Yeah. So the form is for those that attend, because that's the only way we would know that you were here live. Yeah. When you fill in the feedback form, based on that form, we can start sending your attendance certificate for your portfolio tonight. Yeah. So please do fill the feedback form so you have your certificates for attending, because this is like an educational event, and so it goes as CME. So I'm just sending the forms multiple times. So, but I think it's also helpful to ask questions directly in terms of the teaching. So any questions from the teaching based on what's been covered? Okay, any questions? In the meantime, please fill the because that's the only way we would know those that attend. So I can send you, we will send you certificates. Because what we use to do your certificate comes from the feedback. Okay, so there's a question for you, Bartholomew, from those.
Okay.
Why he taught that way?
Okay.
I'm not clear what her question is. Anyway, our first question is, yeah, I've put it up there. Can you see her question?
Okay. Can you give a quick recap or list of how you mentioned to engage someone like a junior colleague when teaching? Okay. Yeah, thank you for your question. I'm not sure I got your question, but I'll try to provide answer. Now, I said to you, I mentioned that there are different teaching methods, and which I believe is the meat of our conversation today. I mentioned that we had the patent methods, we have the dependencies rule. Then I also mentioned that we also have the 1 minute preceptor approach. Then I mentioned the scenario, the case-based scenario. Now, just to give a recap, now, if you have a colleague, you could use any of this approach. Then I made mention of the 1 minute preceptor approach, that we use this situation in word rounds. Now, if, for example, you are on a word round, now, when on a word round, back in the days, what we used to have was a senior colleague, a junior doctor, moving all the stuff. Now, going forward from today, in retrospect, that might not be the best approach. A better approach would be to ask the junior colleague, what do you think about this? Let the junior colleague make a commitment. Are you following? Once he's made a commitment, ask him to justify why he made the answer he made, to give a supporting information. Now, once he has given the supporting, once he has given the supporting information, you find out what made him what made him give the supporting information. Then after that, you teach the general rules. You say to the colleague, this is the general rule. Now, let me say, for example, you are teaching anemia. You ask the colleague, what do you think this patient has? The patient says anemia. Then you now ask him, why do you think he has anemia? He gives a supporting information. Now, you now teach the general rules for identifying anemia. Now, after that, you now mention to him a rule of thumb, a general rule of thumb. Now, from what the colleague had said, you can now expatiate more and tell the colleague what he or she missed or what was wrong. So that is using the 1 minute preceptor approach. Then I mentioned the Patins approach. That one, use it in teaching clinical skills. Now, let's say, for example, you want to teach someone how to set an IV line. First thing, you demonstrate it. We said the first thing is demonstration. Then after demonstrating it, the second step is deconstruction. You talk the colleague through the various steps. Take it one by one. After the deconstruction phase, now you want to find out whether that your junior colleague understands. Then that is when you now take through the comprehension phase. You now ask the junior colleague to explain it back to you. Then you now go to the final stage of performance. So that approach is demonstration, deconstruction, comprehension, and performance. Then the fourth approach, the third method was what I call the Peldesins rules. That one is for feedback. And I said to you that, remember your PLAB 2, we use it a lot. Somebody has given a presentation, ask the person, clarify. You said this, you said that. Did you really mean this? You clarify. That's step 1. Then step 2, ask him, what do you think went well? Step 3, expatiate on what went well. Step 4, what do you think did not go well? Step 5, expatiate on what did not go well. And finally, make an action plan going forward to correct whatever did not go well. Then I now mention the scenario-based approach, that you treat cases based on scenarios. If this thing happens, what will be your approach? Then you analyze scenario by scenario. To summarize, I mentioned the four methods. I mentioned the 1 minute preceptor in word rounds. I mentioned the Patins method. I mentioned the Pederson's rule and the case-based approach. Thank you.
Okay, amazing. Thanks for a very detailed response. Fine, so you have another question. I've put it on the screen as well.
Yes, thank you for your question. What are the major barriers to teaching for doctors in the NHS? That's the first step, major barriers for teaching for doctors in the NHS. And what means are employed to overcome them? Yes, thank you very much. Brilliant question. Now, Dr. Jonathan will attest to this. One of the major barriers to them is time pressure. They have a list of things to do. So it's a lot of pressure on them. And now you have a colleague who seems to be behind in the team. Perhaps maybe you are the is it preceptee? Is it the preceptor? I mean, you are the mentor, mentoring a preceptor. So you have a lot on your hands to cover. Now, how much time do you have to take on the preceptor? So you have a lot of time pressure on you. Then another one is managing the level of knowledge. Now, if you have somebody whom the level of knowledge is very low, it might be a lot of pressure for you managing such a patient. So it's going to drag your patient's level. Then another one for you is your confidence as a teacher. You know, this is a new place, a new culture. You just came into the system. You just managed to survive. How confident are you? I mean, how often have you managed the scenario you are asked to teach someone? So your confidence level as a teacher. So these are some of the problems people go through. Then the question said that what means are employed to overcome them? Now, for the first problem, commitment. Commitment. If you are committed to teaching, like they say, if there's a will, there will be what? There will be a way. If you are committed, you want to help this person, some way, somehow, you find a way to helping that person. Now, another way to help the person is sharpening our teaching skills. And this is what this forum is about, how we can better our teaching skills so that whatever opportunity we have to impact people, it will be efficient. Let's say, for example, for that person that has a low level of knowledge, you just have to have a sharp teaching skills to helping that person. It might be to signpost the person to materials or resources which can help the person to be able to catch up. And above all, a friendly environment, an environment that promotes learning, an environment where you can make mistakes and they will not sacrifice you. These are many more things that can help in such a situation. Thank you.
Amazing, amazing, amazing. Good job, good job. Yeah, I think with what he said, I think just what I would add is you hardly become good in anything without effort. And the effort needs to be consistent. So I think that's the first thing to mention. So you have to be consistent with your effort. You have to be determined. You again have to try and have something to offer. You know, that's something that makes people want to come to, learn. Also, it makes people have like a better opinion of you and things like that. So again, persistence, coming, putting yourself forward and all of that. So as we're rounding up, we'll take a few more questions while we start, issuing. I believe everyone that is entitled to a certificate should have put in their, filled in the necessary details so we can offer everyone their certificate. So please do ask your questions if you have. So we have, I think, 25 people who have attended, which is an excellent. What certificate can one do to show? So there are many ways to demonstrate teaching. There are many ways to demonstrate teaching. One, attending teaching is important. And then, of course, coming to teach on this platform is a good way, because this is going to be on YouTube forever. So that's one. Then someone has asked, I was hoping to see, and that's why we created the program. As you engage, with us, you stay under myself and Bartholomew, everyone becomes better. So as you engage, we share resources with you, we offer you peer review, and you develop. That's the essence of the IMG development program. It's not overnight, Ahmad. Again, you have to put the effort in. As you put in the effort, you put in the night work, As you can see, I'm multitasking. I'm making sure people get their certificates. I'm making sure, but in terms of and all of that, making sure people get their certificates and everyone, gets value for the teaching. But the point I want to say here is, in terms of value for this platform is highly, accredited. Myself, so whether it's in surgical education, whether it's in medical education. For instance, I'm a member of the Academy of Medical Educators, which is the recognized body for setting standards of teaching in medical education in the UK. I've been a member for the last 2-3 years, and I'm also a fellow of the Higher Education Academy, again, which is the body that sets standards for teaching, quality of teaching across UK universities. I've been a member, I should be due for senior membership even. I've been a fellow for 5 years. And then, of course, with the other teaching experience. So I say this to say that it all comes down to engagement. Yeah, attend the teaching of others, volunteer to teach. I've made this platform very accessible. You are welcome to put your name down. We give you the opportunity. Bartholomew is coordinating. You do the research, we help you with peer review, and you teach. Your colleagues give you feedback. We share the feedback with you, and then you develop your own teaching practice. I don't know if that's so. In the short answer is, the way to know how to do a presentation like this is to actually make one. Yeah. Okay. So I'll take one more question before we round up, so I can, get everyone's certificate ready this night. Okay. Any more questions from us? For us? Okay, so thank you everyone for attending. Thank you to Bartholomew for such a very good presentation. we will be ending the live stream now. We will see you again shortly for the next session, and please continue to engage. Someone has asked for certificate. You will be getting your certificate for attendance tonight, and if you deliver a teaching, you get a teaching certificate. Thank you, everyone, and we'll end the stream in 3, 2, 1, end.